Hi, this is Dr. Kan Guenette. I'm going to show you how to use the IceWave protocol for knee pain today. We're going to pretend that I have pain in my right knee. So I'm arbitrarily calling it a 10 out of 10 so I can see what protocol makes it better. So I'm going to bend my knee. Okay, and we'll pretend that the pain is right here on the inside of my knee. So I'm going to place the tan patch over the inside of my knee and the white patch in the original protocol in the center of the chest on CV17 between the nipples on the breastbone. So now we'll move around a little bit, give it about 10 seconds, and see if the pain is any better. So we'll pretend that the pain is not any better, it's still a 10 out of 10. And so we're going to take the white patch from the center of the chest and we're going to put it on 12 o'clock. If this is the center of a clock, 12 o'clock would be somewhere up here on the leg. So we would temporarily, you can even put it on clothing, on top of, the 12 o'clock on top of the tan patch. And then after 10 seconds, move around again. And we'll pretend out of 10 that it's a little better. So we'll say it's 7 out of 10 right now. So we'll keep that in mind. Let's see if we can get better than 7 out of 10. So this is 12 o'clock. Let's do 3 o'clock. So 3 o'clock would be a little bit further back here on the inside of the knee. And again, after 10 seconds, we'll move it around. I'm speeding this up, obviously. I'm not going to wait the 10 seconds. And we'll pretend that it's about the same, about 7 out of 10. Now we're going to use a 6 o'clock point, and any point below this is fine. You can actually even do, 6 o'clock all the way down to the ankle if you'd like, or even down to the toe would be fine. And so again, you'd move around the knee after 10 seconds and decide, okay, well, we'll pretend this is a little better even. So we'll pretend it's maybe, a 4 out of 10. So we'll keep that in mind, that was a good location for that. Now let's switch it to 6 o'clock, see if we can get any better. So if that's the center of the clock, 6 o'clock would be approximately here. And after about 10 seconds, again, you're going to move the knee around, see if the pain is any better, and we'll pretend, that now it's maybe it's a 2. And then the last one here is that you can actually put it right through the knee, almost as if there's an arrow going through one side out the other. So you can actually put this right behind the knee. And I do actually find this works fairly well with a lot of people, although it's inconvenient to have a patch right in the knee crease underneath. But we'll put it behind the knee here. So it's shooting right through the knee tangentially. And then again, moving the knee around. And we'll pretend the pain is maybe like a 1 now. So we'll say that this was our best point for this particular case. Now, for example, if you didn't have any response, first of all, check if the patient or the person is well hydrated. And if they are, then you may want to try the white patch over the area of pain. And then do the Halter-Wenger cross protocol again, 12, 3, 6, 9, and through and through to see whether or not the white patch works better for the pain. And occasionally one will work better than the other, and occasionally after a few hours you may need to change it because people's requirements for energy healing do change with time. So that is the Halter-Wenger cross for knee pain for the IceWave.